Subscribe to our YouTube channel and don't forget to press the bell icon to get our latest updates.
I'll ask you this question. If most dementia patients or even elderly people become very repetitive. It's the same with my mother. She complains of pain, hunger, or weakness. It's difficult for me to understand when it's real and when she's just being repetitive or trying to get attention. I'm afraid I should not ignore her when her problem is real. How do I deal with this? Do you have any suggestions?
Yeah, so earlier even mother-in-law you keep on repeating that she has not had food, she has not had food. So what initially I didn't understand how to deal with it, so that we will just try to argue with her, like, just now you had your food and you washed your hands, you have had your medicines also, why are you coming to the kitchen again to have food? Then she will get agitated as usual. But then later on, after coming in contact with DEMCARES and the support group, we learned to be in her flow rather than expecting her to come to our flow of things. We trained ourselves to be her flow. For example, if she would say, I have already had food, then we would just leave her at that and come after 5 minutes again and give her food. Because later on she would forget to have her food. And for morning she would have her breakfast, afternoon she wouldn't have lunch, and if asked she would say, I just had. She would have forgotten that she had had food. But then we would just leave her at and come back again, and maybe after 5 minutes when we go back to our luck, she would say, yeah, I have not had food, please give me food. So that was in a sense sort of a blessing, because that forgiveness became a blessing in some ways, because when 5 minutes earlier when she denied the food, later on after 5 minutes she accepted the food and she had. So we just need to keep on seeing what works. We have to keep on experimenting.
Right.
That is how we did.
Right.
Being in her flow rather than expecting her to come to our flow. That was very important. That was a great learning in our caregiving.
Thank you, Gomathi. Anything else that Mangala or Sridhar would want to add to that?
I would just say a couple of things. If this problem persists, then while the person is having food, you sit with her and talk with her and say that you are having lunch now, we are having this vegetable now, we have made something in this which you like, something. You just continue talking about lunch. So it falls on their ears or head or whatever you want to say, and they kind of remember it for some time. But if this doesn't help, then you reduce portion of the food, because you cannot have them overeat also. So you reduce the portion, or put something on the table which is healthy, so they can help themselves. These are some of the tricks which we tell them. In some cases it works, in some cases it doesn't work. And as Gomathi said, we have to be really very careful. And I would like to add one sentence which is a very paid kind of a sentence among our caregivers, and that is, you have to be smarter than the patients.
But if the person is complaining about weakness, is there something that doctor, they should be a bit careful about? Because
definitely. I mean, we shouldn't be ignoring the complaints. I mean, as I said before, many a time we will find that people with dementia cannot actually communicate very well. So they may say something, actually they may mean something else.
Right.
So that's very important to keep in mind. So even though, or they may completely deny anything is wrong with them and something is actually very wrong with them. So we have to be very, very watchful. So when they say that there is something wrong with them, it's important to kind of look at it carefully and kind of get them checked out at the earliest if you can, and get the proper medical advice for that. So don't ignore the symptoms just or dismiss the symptoms as they are just saying it to get attention. And that itself is an important issue that needs to be dealt with. If they are bringing out physical symptoms or somatic symptoms as a means of getting attention, then actually tells a lot about that person. So there are things which we can put in place to help this particular person with dementia and also with the family. So there are many things which we can